Thank you, everybody, for joining in on another interview with the Peddler team. And I'm so delighted to have Ralph Ganter with me today, who is the CEO of the Grand Bend Community Health Center here in Grand Bend. And we are so lucky to have this building here. And so it's my privilege to sit down with you today. And thank you so much for your time.
Thank you, and glad to be here. Yes.
First off, Ralph, what brings you to this position? And tell us your background.
Yeah, well, I'll give you my background first. So originally I was trained as a respiratory therapist, and I was a director of respiratory therapy in the Sarnia region, and I was also the president of the College of Respiratory Therapists. So I was really, quite a clinical background. And through that, I was a utilization manager as well at Blue Water Health, and then had an opportunity to join the Ministry of Health as a hospital consultant and as a program manager for the hospitals in the greater area in the Southwest region. With the reform of the regional offices that I was part of, we were disseminated into what were called LHINs, or Local Health Integration Networks. And I was the Senior Director of Planning and Integration for the Erie St. Clair LHIN, which is the Grand Bend CHC is part of. And eventually I became CEO of that LHIN. And after that, I was an ED at for an assisted living organization. And prior to coming here, I was an executive director at the Central Lambton Family Health Team, which is a primary care model, somewhat different than this type of model. But again, I was kind of interested in the primary care because I was more on the hospital side and on the program planning side. So I was interested in, what are the mechanics behind developing good primary care. So what brought me here? A number of reasons. Familiarity with the area. I basically grew up in Pinery Park. I imagine every Sunday we would go to Pinery Park, rain or shine, it seemed. Always been drawn to Lake Huron, the sunsets, and just being part of the beach. But also I have a fairly significant familiarity with the CHC model. When I was LHIN CEO and planner, Senior Director of Planning and Integration there, helped create some CHC satellites in Walpole Island First Nations, as well as Leamington. And of course, the CHCs were part of our funding accountability, so we funded programs and so forth. And also had a fair amount of experience in terms of investing in community programs, such as acquired brain injury, Meals on Wheels, transportation. Like if you see the CareLink vans that go around, those were all vans that we funded to help with transportation in our region. And why come here to this site? Well, again, as I said, I grew up in Pinery Park, and I have a cottage up towards the north as well, and come past here quite a bit. And really, probably the driver is that I was interested in this model because it's a different model than the family health teams are. And this model is much more comprehensive, and I think you have a better opportunity to develop good patient outcomes, which is really everything that I've always wanted to do, was to make sure that we find a way to have the best possible patient outcomes. Like, what's that recipe, right? So I found that the CHCs are a really good opportunity to do that. And, it's an integrated model. It's got a number of the ancillary healthcare professions, such as physiotherapy and OT and dietitians, which some family health teams or primary care organizations just don't have access to. So for me, what is that recipe that you need to kind of have the best possible outcomes for patients? And what's nice about this as well is because it's a bit of a smaller CHC with a bit more of a defined population, it's really a good opportunity to do tests of change, to try to do things and see, can we become an exemplar for healthcare across the province, because we've got the evidence right here in terms of what our interventions were. So a little bit of the background as to why I came here, and of course, being right near the Grand Bend beach, not a bad thing either, right?
Well, I can sense a lot of passion in what you're talking about and where it comes from, and to have a familiarity with the area like you do, and the passion, that side of things too, just sounds like a great combo. You actually got right into the next one of the questions I want to ask you is the Grand Bend Community Health Center, envelope of services. Yeah. You hit quite a few of them already, but give us an idea of the plethora of classes and programs that we have here.
Sure, yeah, and it's evolving, right? Because we want to keep evolving based on local needs. But the biggest service probably is primary care. So we do primary care, and I know before we talked, a lot of people come in for for the essential primary care services that this organization provides. But again, we have these other services, and such as physiotherapy, as I said, OT, dietary. We have a diabetes team. We have social workers, kinesiologists as well to kind of help out with fitness and so forth. As you walked in, you saw fitness classes taking place here. We have programs in mindfulness. I have to go through my list as well because there's so many. Mindfulness, a persistent pain program, a back school for people with back issues. Our physiotherapists do that. Tools for caregivers, bone health, of course, because lost the word for it, but like the orthopedic side of care is so important. Coping with grief, functional fitness. We have cardiac rehab, which is key, right? Memory and aging, and of course one program that near and dear to me because I was a respiratory therapist is Stop Smoking program. And there's more than that, but that's some of the highlights of what we have here.
That's incredible. And I think thankfully I haven't had to get involved with any of them besides the primary care side. But I know my mom does the classes here, and I don't know if she's in this one right now, but I know she absolutely loves coming them out to these. So
perfect.
Initiatives that you guys are doing to attract more doctors or health professionals to the area. I mean, being a local, just to hit it first is, once this building was here, it already started naturally attracting the dentists, the chiropractors, the physio people outside of your building. But what were you guys on top of that to try and attract more?
Yeah, there's a lot of different strategies, right? And that's part of what our strategic plan is all about too, is like how can we make sure we have an environment that is a good environment to attract people, right? But a couple of examples is, so wage parity, wage enhancements is a big thing. So advocacy with government to make sure that the people here are paid in a way that, they want to stay, right? As opposed to perhaps going to hospitals where funding is, where wages are a lot higher. A number of other things too. We're a training site for residents as well as nurse practitioners. So what you usually find is if you do that type of service, the residents, if it's a nice environment, these are for physician residents, I should just say, they're going to want to stay, right? Or they're going to be attracted to the model as with nurse practitioners. We're also going to be a Practice Ready Ontario assessment site. And what we want to do there is, this is a program the government has, and it is to try to bring foreign trained physicians who have experience as physicians into the Ontario service environment for physicians. So we want to become an assessment center for that. So we have our physicians who are interested in being assessors, and what they'll do is they'll assess these individuals to make sure that they are adequately prepared to actually challenge getting into the CPSO, the College of Physicians and Surgeons of Ontario licensing program. And part and parcel with that is we've done applications through the Practice Ready Ontario Physicians initiative to actually see if physicians would be interested in coming here, right? So I have 5 applications that we're going to be looking at later in the month. And again, these are people who are trained outside of Canada, but incredibly experienced. They are in Canada right now, right, not working at their professions. And if they go through the assessment center, as I said before, and if we find an individual who matches our needs, that person would be at least for 3 years committed to staying in the region. And the thinking behind that is if you're here for 3 years and you develop relationships, you'll probably stay longer than that, right? The other thing that we're doing too is we're preparing ourselves for a business case for expansion for services. We know there's thousands of unattached patients in the Huron County region, right? And what we'll do then is to do a business case because our funding model is a little different than others. Our physicians are salaried, so we have to get a base budget for those physicians from Ontario Health, right? So we'll make sure that with this year's funding opportunities, we'll put a business case in, hopefully to, add on. I have in my mind the round number of 1,000 unattached patients. So that'll help attract not only physicians, but the ancillary professionals that you need around that, right? Because some of those patients will need mental health services, they'll need dietary, so we have to make sure we've got all those professions. And then the last thing I think is probably the most important, to attracting is, you know, having an enabling culture, right? You want a culture whereby people feel comfortable working with each other. There's a good exchange of information. If you have that, you know, it's your brand, right? So if we have a good culture and have a good brand, I think that helps attract people as well as retain people.
Mm-hmm. That program with non-Canadians coming over with the doctor skills and then training them in our health standards, how long has that been going on for on the provincial?
Not long. It's only about a year and a half.
Oh,
yeah,
wow.
Yeah.
Very
I think
cool.
last year was the first year, and this is year 2. So
Very cool.
yeah.
Big reason for sitting down with you today is the strategic plan.
Yep.
For the Grand Bend Community Health Center, and that was the last one was created in 2021, and now we have the new one that you guys are starting to get data for, and you have some stuff coming up here. And so tell us all about what was the strategic plan's goals, viewpoints of 2021, and moving into 2026 when the new one will be created.
Yeah, so I think 2021 and 2022, or that strategic plan, was in a sense a strategic plan that kind of brought the organization out of the pandemic, right? To kind of get itself reset, and a lot of it was about partnerships and, you know, how do we kind of get ourselves on the right foot moving forward again, right? Because the pandemic had such a, you know, drastic impact on healthcare performance and healthcare organizations in general. So we want to build on that, and we're refining our thinking a little bit. We're using something called the quintuple aim, okay, so a fancy name for something that has, it's 5 pillars or 5 like drivers of a good healthcare system. And if you think of it, it's almost like if you have a table, and this isn't a good table because it's not not set the way it might be, but if you look at a table, it has at least 4 legs, right?
Okay. Yeah.
And you have to have those 4 legs work, right? They have to be constructed well. Otherwise, the table will tip over if you have any kind of weight applied to it, right? With healthcare, we think it's a 5-legged table, right? And that's what we call this quintuple aim or quintuple drivers. And think of it also as like a GPS, like north, south, east, west. You need to know where you're at in order to like kind of, you know, move to the next place, but you have to be orientated in terms of all those different markers. So for us, we've got 5 different they're called pillars or drivers. The first one is value for money. The second one is population health outcomes. The third one is improving the patient experience. The fourth one is improving the provider experience. And then the 5th one deals with equity, health equity, making sure everybody has a chance to get the care they need, especially within our postal codes of our catchment area. So what we're trying to do is we're trying to build our strategic plan around those drivers, those markers. So for example, with value for money, I mean, healthcare is expensive. Our service is a pretty economical service versus somebody going to emergency department for the service. So, you know, our effort has to be, you know, the best possible outcomes at the most economical, efficient cost, right? So it's always going to be that kind of yin and yang, but we want to get to that point. But at the same time, you know, a lot of times you focus on cost and budgets, but at the same time you need to focus on healthcare outcomes. So examples of that is like we'd like to see reduced admissions to emergency department and to hospital. We'd like to do much more evidence-informed practice, so the best possible post-stroke care, for example, right? Patient experience is really important. So a person who looks at us, sees the brand, should, in a sense, you know, expect comprehensive care, you know, timely care, safe care, right? Very, very important. And then the 4th of 5 is provider experience. So, you know, we want to make sure, as you just asked me, how do we retain people? How do we make sure they have the right tools so that they can actually provide the care as well as possible? And a culture, again, that's an enabling culture, as I said before, that they want to stay here, like that they you know, that they're happy at work, right? And then equity, as I said, as part of the group is, and I think I've already mentioned this, is like everybody who has a postal code in our region, no matter what their background, should have an opportunity for the best possible healthcare outcomes. So we want to make sure that we develop services so that we are as inclusive as possible. So the strategic plan and the event that we're having on April 14th is really We have some recommendations for each of those quintuple aim pillars. Want to show the public why we're doing that, okay? But really hoping that the public will look at our recommendations and add more to them, right? And even if it isn't recommendations, but what activities, because then the activities is almost like in a big pick list of opportunities for us to think about over the next number of years. Mm-hmm. So that's what we're hoping to do on the 14th, is just to give people an introduction, but give them a chance to just give us a little bit more depth in terms of what we're thinking.
And where on the 14th, where is that being held? Is that a virtual, it's in person?
No, what we're expecting to do is an open house. So we're going to be doing it right here in the community room that you walk past.
Okay.
So that's our site. Yeah.
And that's going to be all day, or?
It'll be 3 to 5 p.m. on the 14th.
April 14th, 3 to 5 a.m. p.m.
Yeah. Well, we could do AM as well, but PM is probably better. Yeah.
Okay, we'll make sure we get the AM and the PMs, right?
Yeah.
Oh, that's awesome. We'll definitely put out some posts closer to that and all that
Sure.
good stuff. So we definitely, getting the community involved. This is the community's health center, so getting their input is important to you guys.
Well, we are here for them, right? So they're closer to what the needs are than I am, right? So we need to listen, right?
Well, and from the real estate perspective myself is, I always get asked, like, we were historically a cottage country, and it's this building that started that change to year-round is very possible. I don't need to drive to London for all my things, and so we are so lucky to have a building like this and have the services, as many as you just listed and the many that you didn't list, that there is available there. And for someone wanting to know more information, the website's probably their best avenue.
Yeah, the website's probably going to be the key one. Obviously, your work helps us with getting that information out, but we'll have posters as well, and we'll just circulate through some of our different service agencies and partners. So, but the website's probably going to be the best place to look.
Awesome. Well, it's really cool to see how active this place is. Pulling in here today, the parking lot in the back's full, the front's full.
Yep.
That's pretty awesome. So.
Absolutely.
Was there any other things that you wanted that I didn't hit here? And
not really. No, it was a pleasure to talk to you, and hopefully if people see this and they have other questions, they can reach out to me as well.
For sure. Well, no, I really appreciate your time, and hopefully those who watch this get some insight and take advantage of this incredible building that we have here and all the services that you guys are taking part, and come April 14th between 3 and 5 p.m. to for the community input to the strategic plan moving forward.
Perfect.
Awesome. Thank you so much.
Okay.